Hi, everybody. This is Dr. Kirsty with Rewilding the Feminine. Interviews with the and work they do to the healing arts. I'm excited to bring Dr. Lily Bleeker. See, I can't even remember that. Bleeker. I've heard her name pronounced, but anyways, Dr. Lily is what she goes by. So she's a doctor of naturopathic doctor and a doctor of Oriental medicine. And one of the things that we're going to talk about today and very excited about is her advocacy for naturopathy in the state of New Mexico. And now that we have licensure, and I know that I've been involved heavily with the massage board and like scope of practice and different licensure laws. So I know how much work that takes, Lily. So really thank you for bringing that to the forefront. That's huge work that you've done. And talk about what naturopathic doctor does and what that means and how that looks in practice too. But let's talk about the advocacy piece, because I just think about all the times I've driven down to legislature to speak up on the behalf of something. I don't think people realize it's volunteer work, and we get in our cars and we drive down from Taos down to Santa Fe, and we usually know last minute. We cancel all our clients and patients for the day, and then we show up to speak for maybe 2 minutes on the floor. I don't know if you had the same experience.
Yeah, a number of times now.
Yeah. So, and I've had that too, so I can relate. But yeah, let's talk about what that's been like. But talk about what naturopathy is first, naturopathic doctor.
Yeah. So yeah, I became a naturopathic doctor in 2009. I'm sorry. Yes, 2008. Yeah, I graduated in 2008. And naturopathic doctors are primary care providers. We're considered holistic primary care providers. We attend, full pre-medical degrees. So my Bachelor of Science is in chemistry and biology. And then we attend medical school, which is a full intensive residential program, meaning that we're in the school, we're in the clinic, and we do a huge amount of didactic coursework as well as clinical coursework and clinical hours. I think it's over 4,000 clinical hours that we do in our undergrad in our graduate program. If we do
That's
naturopathic, if we do naturopathic medicine and Chinese medicine. So it's a huge amount of hours. And then some of us do residencies that we don't have the robust infrastructure for residencies that conventional medicine has at this time. But I was fortunate to have a position, a residency position for actually a few years. So as naturopathic doctors, we're trained in a very, very broad toolkit in terms of modalities that we use to treat. But I think what's most important about our work and what really distinguishes us is that we have the perspective of gathering an enormous history from our patients, doing very, very thorough diagnostic work. We use all of the same diagnostic tools and criteria that conventional medicine uses. And we also have a whole slew of functional medicine tests and, physical exams that we do as well. So we have a very, very broad perspective on diagnosis, and we look thoroughly towards the root cause of disease. And so I think that, it certainly takes time to do that, which is challenging in the current healthcare system. It requires that we have a lot of different perspectives that we're looking at patients from. So we're looking at constitutional types, we're looking at genetics, we're looking at nurture, of course, and all of the things that have happened in the lifetime. We look at the pregnancy, that occurred when that person was a fetus. We look at really just about anything that we possibly have in our toolkit to use for diagnosis. And then we use, for our treatment tools, we really have a slightly different hierarchy of treatment tools in that the first line for us is lifestyle changes, and making sure that the environment that the patient is in is safe and the community is safe and all of those kinds of things. And then diet and exercise are, you know, frontline tools. Homeopathy is a frontline tool. And then as we get, you know, acupuncture is a frontline tool. But then as we get into cases that are more complex or that require more steps to get to the place where lifestyle is going to do what we need to do, then, you know, we also use botanical medicines, which in my view function very much like pharmaceutical medicines, actually, in that they have a, you know, scientific mechanism of action and intervene in those sorts of pathways. We use a lot of nutritional supplementation in order to give the body what it needs to make sure that we're supplied with what we need to have proper immunity or to, you know, fight cancer or whatever it might be. And as a really kind of a last line, we use suppressive tools such as, you know, steroid medications or, you know, blood pressure lowering medications or whatever the we need in order to save the life or maintain the life of the patient, and buy us time to get to a place where the other tools are going to be effective. So our hierarchy of cure, I would say, is a little bit different from a conventional provider, but we are very much primary care. And we also do a lot of hands-on medicine, like physical medicine, adjusting, you know, trigger points. We use intravenous nutritional therapy. We use hyperthermia. We use anything that might work.
It's a broad toolkit, right? It's a broad toolkit in some ways because with the hands-on. But so how would you say that? I don't know if this might be. How would it just be distinctive from like osteopathy?
Yeah,
I don't know.
Yeah, it's historically a
manual.
different lineage than osteopathy. Osteopathy has always and still does emphasize physical medicine and has very specific osteopathic tools, as I know you're aware. But
yeah.
And we, you know, many naturopaths are trained by osteopaths in various ways. And so many of us do use osteopathic tools. But we're different also in the advocacy piece. You know, osteopathy really started a long time ago to resemble conventional medicine very closely in terms of the training, and of course has additions to it. But osteopaths have been viewed as primary care providers and you know, sort of mainstream medicine, I think, for quite a bit longer than naturopathic doctors have been. But we are certainly moving in that direction, I would say, as a profession.
Yeah. Do you find it challenging to navigate the naturopathic perspective with the primary care, more allopathic, traditional allopathic? Or are you able to kind of, you know, from that integrative medicine point of view, be able to kind of, I don't know, I call it straddling over both fields, kind of is the way I think about it. Like, you know, like there's a line of chalk on the field. I always think about baseball or something like that. And, you know, I have one foot in one field and one in another. And I was like, okay, no, I can do this. I can bridge.
Totally. Yeah, I think because of my residency, and my residency was really thorough and comprehensive, and I worked with a lot of different medical doctors and specialists. I learned to speak the language of medicine more than I would have without that residency. And so I have found it really wonderful and productive to work with medical doctors and nurse practitioners, because we've taught each other so much. I mean, it's really extraordinary how much we've taught each other. And I learned so much about managing cases from them, in the sense that, you know, they really have a very nice, efficient, organized way of managing a person's healthcare cradle to grave. And that's hugely, hugely important in primary care. I think what's been challenging really has had a lot more to do with time. I have as one of my fundamental principles, is access to the full spectrum of healthcare. And so that's something that I'm here to do, is to help people of all diverse backgrounds and income sources and resources, right? Financial resources, to be able to access more than just a very narrow version of medicine, right? And so I want everyone to have access to the full spectrum. I think that that's what's going to bring us as a community to a better place. It's going to mean that people are able to reach their full potential. It's good for us economically, it's good for us socially, and it's the world that I want to see happen. And so with that, yeah, go ahead.
Oh, I was gonna say then, so there's a huge that you brought up, that advocacy piece. So there is a huge piece of advocacy for you. So are you having to, like, I don't know, I'm imagining you're out at nighttime or early in the morning making phone calls and trying to get people access to stuff they wouldn't normally have access to, and they don't realize, I mean, because I know that with just a little bit of the medical billing, and sometimes, we're not paid as practitioners, where there are a lot of things that we do behind the scenes that the patient may not see. I guess that's what.
Oh yeah. I mean, that I have to say, the medical doctors that I work with, I feel for them even more than for myself, in terms of how much advocacy they have to do and how much time they have to spend on the phone behind the scenes, and how little gratitude and appreciation they receive for the extraordinary amount of work that they're doing all the time, and that our whole staff is doing. So that my future looks more like that, unfortunately or fortunately, now that we have licensure in New Mexico. And I anticipate more and more of those pieces. I think for me, the big part has been pushing to get naturopathic medicine covered by Medicaid. And that's been my huge advocacy push. And when I look at that, that brings up real challenges for naturopathic medicine, because reimbursement from Medicaid is extraordinarily low. And so there's no way that one could, even with a very pared down business model, there's really no way that one could spend an hour and a half with a patient for those kinds of reimbursement rates. And so that's something that absolutely has to be bridged. And the only real way to bridge that right now for us is to have shorter visits and hopefully be able to see our patients more regularly to follow up. But it does look much more like the conventional model when we start accepting Medicaid. And for me, that's a top priority. And it's something that I know a lot of my patients will be extremely grateful for, but there will also be a lot of folks who feel that it's sad that naturopathic medicine has had to happen in these shorter time periods. It's really one or the other, though.
Right.
And so that's something that I grapple with because of working in the current healthcare system.
Yeah, no, I know that when I did the apprenticeship in midwifery, and that was some of the biggest issues that they had, because the reimbursement rates from Medicare were like significantly lower for a midwife, a licensed midwife, compared to a licensed OBGYN or a licensed midwife nurse attending the same birth. I mean, it was like a quarter to a tenth of the reimbursement. And a lot of people realize that. Yeah.
We won't be looking at that kind of disparity. It's for us, it's just more that all of the rates for everyone, for medical doctors, for everyone within Medicaid, are just exceedingly low. And so it's a choice. It's a choice that a provider makes, and it's a foundational choice, right? So a provider can absolutely choose to just not accept Medicaid and have cash pay practice and have nice long visits, and they can do that, and that's something that's absolutely valid to do. It's just not what I'm going to do, because what's most important
for that.
What's that?
Yeah, commend you for that, because that's that's a different kind of work that I just want to honor that. Yeah.
Thank you.
So you're you got the license number 1, right?
I did. I got ND number 1. Really big moment for me, I have to say. Working on the advocacy towards licensure is probably one of the coolest, most interesting, exciting. It's just thrilling. It was absolutely thrilling. When I moved to New Mexico, I didn't really have a dream that naturopathic medicine would be licensed here. I thought it absolutely would not. But in that time, a few recent graduates moved to New Mexico and got really fired up, and a little group of us started working on it, and we were successful, and it just felt absolutely, it felt magical. It felt like we were being carried there by angels or something. It was just extraordinary. And we were able to establish very, very close relationships with all of the boards, of all the other medical boards, in especially the MD medical board, the New Mexico Medical Board. They've been very, very supportive and really helped us to complete our bill, and we negotiated a lot of factors in that bill with them and with the Doctors of Oriental Medicine. And we came to the table with full and complete transparency, letting everyone know what it was that we wanted to do, and wound up establishing really close and personal and lovely relationships through that, and have gotten a lot of respect. It's been wonderful.
That's great. No, and I think right time, right place to have it happen too. It was primed. And we need you guys. We need you guys practicing. I mean, especially up here in rural New Mexico, we just don't have enough access to care. So I think it's really important that we have more access to care. Okay, so I want to switch topics a little bit. I didn't think about asking this in the beginning, but I know you know about this, the gut biome.
Sure.
Right? The gut biome. Yeah, I know, because you know a lot about the gut.
I do.
Yeah. Let's talk about the gut biome, because a lot of people don't know about it. And I happen to love the gut biome, but I also happen to really love the vagus nerve. And a lot of the work that I do works at treating the vagus and taking people out of sympathetic into parasympathetic and giving them that general reset. And gut has such a huge piece to play in vagal tonal response and that fight or flight patterning that people get stuck into. And they may not realize that the gut is involved with that level of, I don't know, I just want to say anxiety.
Yeah.
Right?
Now's a great time to talk about anxiety too.
Yeah, I think so. It's relevant.
Yeah.
So
as a naturopathic doctor, I would say maybe you should be one because those are really the two cores of our etiology. Would really be the way that we interface with the outside world, right, which happens through the gut, and that microbiome within the gut being the communication between us and food and the outside, the things that we put in our mouth all day, every day, right? And then from a neurologic perspective, or again, just cause of so many dysfunctions, it's extraordinarily common to see patients who are stuck in one or the other pole of the autonomic nervous system. So there are some people who are just so sympathetic dominant that it's not worth it to sit around talking about what you should eat, when what we really need to talk about, or what we need to get into, is improving the parasympathetic rest and digest tone, so that patients are able to even digest and absorb anything that they put in their mouth. So those are really the two primary causes of dysfunction, is the nutritional and digestive system, and the autonomic nervous system. So there's very little that doesn't come down to that. I remember talking to somebody, to a patient, about leaky gut or intestinal permeability recently, And they said, well, what caused this in me? And I said, well, it's hard to say. Of course, I don't know exactly, in that I didn't know yet. But the most likely causes would be something within the digestive tract, either food sensitivities or dysbiosis of the microbiome, or on the other end of that spectrum would be simply being sympathetic dominant. Another extremely common cause of intestinal permeability being in a fight or flight state while consuming food. You're going to wind up with the same type of inflammation and reactivity as you would if you were eating something that you're allergic to. So yeah, just about anything.
Pretty powerful. Yeah. Well, I mean, I used to joke, I have my students do a nutritional journal, emotional journal, spiritual journal, like across the board.
Yeah.
And they do a little emoticon and they talk about everything they're doing through the whole day, and they do it for 30 days. And one of the first things I say is, I don't want you to change anything, which rarely happens, that somebody actually can go for 30 days and just track what they do. But I remember when I done that on myself, I used to say I was the queen of the power bar and the apple as I was driving up to the ski valley to give treatments. And I was like, wait a minute, I've got to stop this and sit, block out a time to be in resonance with my food. Because I love food, and I love healthy food, and I love whole vegetables, and I just love to, I mean, you can already see it. I'm like getting salvation, but I realized that I was just doing a service to my own gut biome and my own health, because that driving is such a sympathetic charged moment.
Exactly.
I mean, there's nothing, anyways, that was just, I just remember.
That's exactly right. We're constantly putting food in. I mean, many people are putting food in when the body is in no way prepared to receive it. And I think that that's, actually indicative of a lot of the paradigm shift that naturopathic medicine brings to the table, is that we're not just looking at the offender, right? Like the infectious organism, for example, now being a time we're talking a lot about infectious organisms. We're not just looking at that. We're not just looking at the offending food. We're not just looking at the offending person. We're really looking at the whole picture, at the milieu or the environment in which that issue or, that aggressive factor is coming into. And so to us, we recognize the importance in that environment in terms of, let's say, our ability to catch an infection or our propensity to catch an infection. We recognize and know that there are so many infections that become chronic in some people and absolutely don't in others. And so we're really looking at that difference. We're looking at what is it in this organism, this body, that's protecting that person from having, let's say, chronic Lyme disease or something. And what's different about this person who was able to kick it out, right? And how can we change the milieu or the environment of the person who has developed the chronic infection so that it can look more like the environment that would have an acute reaction and kick it out. So we're doing that in so many things. It's not just the food that's bad, it's the drive to the ski valley in this case.
Well, yeah. Well, I mean, you can imagine that's like in the snow, and there's like a whole bunch of things that shouldn't have to do. I mean, but by tracking it, I caught myself. So it was good. I was able to shift, and, I had the wherewithal to go, oh, this isn't the best thing. Let's make a change. I like the whole idea of the milieu, and I know, like with Oriental medicine too, we talk about the root cause, like, the symptoms of being like the branches or something further out, but you want to speak to those deeper roots. Yeah. And, everybody's starting gardening right now, right? We're all putting our starts. I don't know if you are, but I am.
We have a tiny garden.
Yeah, I'm starting a tiny garden too, and it's fun. but you know, the importance of soil, right? Like you can't, it is so hard to grow here because I know you were in Portland for a long time and I was in Seattle, and I used to joke I could go out in the backyard and toss seeds over my shoulder and walk away and they would grow.
Yes.
Literally in the Northwest. It had the right soil. Yeah. It had the right amount of water. It had like, I did all, and my main job was weeding. Here,
Right.
it's a whole different thing in Taos. Like I have high wind, alkaline soil. Like it is so hard to get the right pH and the balance. And like, there's no just like throwing seeds out and anything's going to grow.
Exactly. No, exactly. And it's the perfect analogy to look at the different medicines through, I think, too. I mean, Chinese medicine is so extraordinary because it looks not just at the person, right? The patient that's in front of the person, but it looks primarily at the full environment surrounding that person. So we're looking at time, right? Cycles of time all the time. We're looking at seasonal changes. We're looking at pH differences in places. You know, we're looking at dampness versus dryness. We're looking at all of the environment that surrounds us and trying to get as in sync with nature as we possibly can, because nature's just so huge, and why would we fight it? You know, it's like a terrible uphill battle you would never want to fight, right? So
Yeah.
better to go to sleep with the sun and wake up with the sun, and you know, allow your internal hormonal system to sync with that. So yeah, I think, you know, from a gardening analogy, we're looking at the sun, we're looking at the soil, and it's, you're right, it's not easy to do that here, not just in the garden, but also I would say in people. We have a lot of extremes environmentally here, and so some of those challenges do definitely filter into my practice, in that I see a lot more issues associated with dryness, for example. So I see a lot more constipation, right? I see a lot more, of course, skin issues. I see more issues that are related to what in Ayurvedic medicine we would speak to as vata, which I know you're familiar a lot with the doshas, but like these vata issues in terms of, you know, people being very heady, and we see more mania, and we see more kind of like externalized emotion actually here than I used to see, let's say, in Connecticut. It's these very vata issues. And sleep, insomnia. I see a huge amount of insomnia here, which is different.
Yeah, there seems like there's a lot of insomnia. I see that a lot in my clients too. And do you think that has anything to do with just the vata, the wind, or also just the high altitude, because we're at 7,000 feet plus?
Yeah, I don't know. I really don't know. I think, yeah, I would say, you know, again, from a Chinese medicine or Ayurvedic perspective, traditional perspective, the energy in the body is up higher here. It sort of naturally floats, and grounding, the rootedness is less, is happening less. So, yeah,
That's so
I don't know why.
Yeah, that's interesting, because I really found that my yoga practice living here has really changed into more of a rooted practice, more pelvis, leg oriented. And I don't really care so much about this part of the body. I'm more interested in bringing energy down all the time.
Yeah.
And
Yeah, I can see that actually. Since I've known you, I can see your body has changed in that way. And it's a good thing. It's a really well suited for this environment to have that kind of sturdy grounding.
Yeah, and I feel like I'm more connected to earth here than I was in the Northwest in some ways, because the Northwest does have this too, but in a different way. I think it has to do because we're shut inside because of the gloomy, dark weather so much of the year, and the gray. Like I did a lot more creativity inside, highly creative, but here I spend a lot of time outside. But my personal practice, I spend more time focusing on roots.
Mhm,
and like
mhm.
grounding and energy, just like it seems imperative for my own health.
Yeah, yeah, I would say I can relate to that.
Yeah.
I did a very active yoga practice the other day, and it felt good, but it felt like I kind of left my body a little bit. And then the following day, did a yoga practice that was specifically designed for restoration and grounding,
Mhm.
and one of my favorite teachers. And I felt so much better after that practice, that I thought, well, okay, maybe I'm going to put the more active yoga to the side for a little while.
Yeah. Well, that's interesting. I mean, I do get my active on my mountain bike, so I get an outlet for that. But I found that the practice, and then because with the meditation and stuff, it seems, yeah, it's just like a life skill for
Yeah.
living in this very like high wind, dry environment, which is like the opposite of what I grew up in. So,
Right, right, exactly. Yeah, it's taken me a long time to assess the environment here and get a real understanding of what my patients are contending with, that's different from the other environments that I've practiced in. So the two other being the Pacific Northwest and the other was the Northeast. And so we just see extremely different changes. One very distinct example and kind of how I started to realize this, was that I personally was super sensitive to dairy when I lived in the Northwest, extremely sensitive to it, couldn't have it at all. And when I moved to Taos, I continued to be dairy free. And a few years in, I realized I had some dairy, and I realized I felt better with it than without it. And that, I mean, I couldn't tolerate it at all prior. So my body has reacted completely differently to the dryness versus dampness spectrum that I've been on. And that's obviously really informed my practice, because in Oregon, it was very, very easy also with patients to say, oh, okay, gas and bloating, cut out the dairy, right?
yeah.
Moving on.
Yeah.
Because everyone had that dampness problem, and because the environment was so damp that, you know, apparently the indigenous people in the area didn't want to inhabit that valley.
Right. No, I mean, it's so weird because I remember grabbing shoes out of my closet and they were growing mold because it was so damp. Because I grew up on Alki in West Seattle, and it was a beach community, and it used to be the vacation place for everybody from Seattle.
Uh-huh.
And yeah, I mean, like you would literally, like, if you forgot about things, it would grow mold because it was so moist.
Yeah. And here, if you forget about your shoes, there's a black widow spider in them.
Yeah, totally
Right?
different. Yeah, totally different.
Pretty
So
different.
yeah, so let's if I can bring it in a little bit more. So what got you into wanting to go into naturopathic medicine
In
and
Chinese medicine.
Chinese medicine? What was your personal, if you want to share?
Yeah, of course. Absolutely. It's really important. Um, so let's see, of course, I've told this story many, many times. And so I'm just thinking about what feels most relevant at this moment, because it's a long story, of course. But I would say that as a later in my teenage years, I started to develop some health issues. And then once I had graduated from high school and traveled, I was a big traveler. I was a train hopper. I was hitchhiked a lot. I, spent a year in Mexico, and I think my total budget for that year was $1,200.
Wow.
I really lived really close to the ground for a long period of time. And during that time, I managed to develop chronic bronchitis. And I was back in New York at that point. And it turned out actually to be due to black mold that was growing under my bed, but I didn't know it. And I went to my pediatrician because I was still 18, and I was prescribed a number of rounds of antibiotics, and they really didn't help. at all. I think I did 7 rounds of antibiotics. And I was working for a woman at that time who recommended that I go see a Chinese doctor. And so his name is Dr. Fu Zhang. He's still living. And he practiced in Chinatown in New York City. And he had a little spot on the 8th floor of this building. And, you know, there would be a line out the whole door of Chinese people waiting for their appointment with him. And everyone wearing masks. And he saw me for about 5 minutes. He felt my pulse and looked at my tongue and he said, "Call your grandmother." And I said, "Okay." And then he wrote a prescription in Chinese on a piece of paper and gave it to his pharmacist, who doled it out. And I went home and made 10 days of Chinese herbs, and they tasted terrible and they made my house smell disgusting.
Oh, like GAC.
What's that?
We call it GAC.
GAC, yes. Oh,
Yeah.
yes. That's a very descriptive term.
I've done those too.
Yeah. And I was cured. I was fine after that. It was 10 days, and then I never have had any lung concerns since then. So that was really extraordinary. And I thought, okay, well, that guy's magical. And I probably, you know, that's something you have to learn from 5 generations of doctors, you know. And so I moved on and continued my life. But the following year, I found myself in Portland, Oregon, and I was sick again. I had irritable bowel syndrome that was precipitated by a bunch of parasitic infections from travel and, you know, drinking the water really anywhere that I went, and being pretty, I would say, irresponsible kid with my own health in that sense. And I decided I needed help. And so I went to the kind of doctor that had helped me in the past. I went to a Chinese doc. And it didn't wind up helping, interestingly, but I did wind up making a connection with a doctor named Dr. David Freierman, who ran the public health clinic in Portland called Outside In. And Outside In is a really special place, a place that prioritizes care for homeless youth and people with HIV and addiction, but also serves really the whole community with the triad of naturopathic medicine, Chinese medicine, and conventional medicine. And they house people and they run businesses to support so that homeless youth can learn skill sets and all of that. And to me, it was just like perfect. You know, what they were doing was what every community needs. It's a true safety net. It's not just, you know, a safety net in name.
Right.
And it provides a level of security for the community there that I think is very healthy for the people in that community, because they know that even if they don't need those services right now, that those services are available to them. Mm-hmm. And I just was blown away by what that did psychologically for me, was just knowing, oh, okay, even if I can't afford it, I can get any kind of medical help. So that was mind-changing, mind-blowing. And David took me on as his apprentice. So I worked with him for 11 years at Outside In while I went to undergrad and did graduate school and all of it.
Wow, that's huge. What an awesome story.
Thanks.
And I have some correlations too. I mean, I just was thinking, because I had a severe osteoarthritis when I was 19. And that's what got me into body work eventually. And with an undiagnosed condition, and it didn't get diagnosed. It was from childhood and birth, but they didn't diagnose it till I was 19.
Wow.
And went through several surgeries for it, and it's still it's not a fixable thing. It's kind of like I just have a very deformed left foot because of it, and a fusion in my subtalar. But that's what kind of led me. And then I traveled a lot too. I didn't do the train hopping. Now I'm kind of regretting it. I did some hitchhiking.
Still do it.
Yeah. And then I got IBS too, and the parasite stuff. Yeah.
Oh, so interesting.
From all that. Yeah. And I had to work on healing up the whole gut biome and everything. And people just didn't, unlike you, I didn't end up finding somebody who picked up on it, that picked up right away that, oh, they didn't ask that question. Have you traveled out of the country? Have you been to third world countries? Have you, you know what I mean? I mean, that
yeah,
I pick up on it. So it was a little longer fix.
Unfortunately, too, the testing, like an ova and parasite, that is done through some of the more mainstream laboratories, is a great test, but it's also a really limited test because it's not a PCR, it's not a DNA PCR, and so we can't diagnose a lot of the infections easily with the ova and parasites. Pretty easy to miss infections. So having the more functional laboratories that naturopathic doctors use, we can identify even infections that haven't been distinguished, we haven't named yet. So we can really find absolutely any kind of infection as well. I can't guarantee that, but I think anything that's known, we're able to identify. And so we're able to be really effective with those functional tests. And I would like to see more insurance companies cover those tests because it's not, of course, just people who can afford expensive testing who get parasites, right? It's anybody. Yeah. So yeah, we're really lucky to have more thorough diagnostic tools in that, for that particular problem.
Well, there? That's why it's so important that you've brought the licensure to.
Yeah.
Still here.
Okay.
Yeah, no, I mean, that's why it's so important that you have the licensure and everything in place, because we haven't had access to that kind of care. And people who do, it's not unusual for people who are younger to go travel.
Right. Exactly.
That's not, I mean, I have friends who picked up malaria traveling in South America when we were younger and in my 20s and stuff like that. And just all kinds of like weird things from left field that we didn't really know where to go. And we were actually, I think in Seattle, we were pretty fortunate because we did have some access. I think at that time I didn't realize to pay attention to IBS and parasites. And, I was just kind of like, I don't know what I was doing, but I just kept traveling and
not paying attention to that.
Yeah. I mean, it really wasn't the night. I was actually settled and had a home and done with grad school and done and having my daughter that I started to realize, oh, there's something else happening. It made it more clear for me. It took a while.
Yeah. And when we're young, we push through so much too. I think, we really have the vitality and the it's just really the vital force and the energy resources to be able to compensate for a lot of imbalances and not pay very close attention to them. But I think once one problem shows us our mortality, but also shows us how important it is to feel at our optimal state of health, then we start to recognize more and more when we're not in optimal balance. That to me has always been, kind of the thing that comes through all the time as my goal. Of course, my goal for my patients is health, but my bigger goal is helping them to reach their full potential. So if that means that they're going to be walking around on a foot that is fused and problematic for the rest of their lives, right, to some extent, then we have to work out all of the ways that we're going to compensate for that, and even maybe use it as a an avenue to something good, because health challenges are that. They are that for most conditions. I'm sure there are exceptions, but generally they are that.
Absolutely. Well, and that's really great because for me too, I'm working with clients. I'm thinking about how can I hold a container for them to thrive and find that higher level of vitality and feel good about their bodies and come out of, I deal mostly with people with trauma and chronic pain. So, it has some different things involved with it, but yeah, I'm really giving them tools to help reset their systems.
Yeah. And that's why I refer to you and to others like you. Not that you're one of a kind for sure, but I mean, there are really a lot of incredible providers who have tools to help get people from a state of fight or flight into a state of rest and digest, which is the more common direction that things need to go, right? But
Right.
more importantly, doing what you do, which is to tone that vagus nerve and to make sure that we can be in whichever state we need to be in at the moment,
Right. And so,
fully and completely.
yeah, and to have that adaptability so you can respond when you just slam on the brakes, for example, because sometimes we do have to get into sympathetic response. It's
Of
a
course.
really important thing,
Yeah,
part of living, and just like,
exactly.
yeah,
Yeah,
cool.
same as, in our society, we have so much excess food and resources, and calories, right? And fats and all the things that are in the foods. um, and and so our struggle and the way that we frame the way that we see nutrition or those kinds of lifestyle interventions is that it's always about less, have less of that, have minimize the things that are excessive. But in the true spectrum of the world, people need, to either have enough or you really want to balance there. You don't want to have too little either. You don't want to starve yourself. And we
Mhm.
have a very imbalanced culture, I would say, to the large extent. So we're constantly trying to pull back from that excess place. And that's, the case in the nervous system too, is you don't want too much sympathetic or parasympathetic tone. You want both.
Mhm.
But of course, we're so dominant in terms of how much time we spent in the sympathetic place, as a general community, that we're always trying to get more parasympathetic. But the truth is we just want balance.
Yeah. Well, I've
Yeah.
been working at it for a long time. I'm still working at it. I feel like it's a work in progress. So,
For the rest of our lives.
yeah, yeah, absolutely.
Oh, like live work balance, right? I mean,
Well, and your mom. So, I mean, when you balance family, partnership, children, work, I mean, what the heck were we thinking of? I mean, because I always remember these kids remember that woman frying it up in the pan, kind of that song. I don't know if you remember. It was a commercial like for women selling bacon or something. I'm a woman. It was a commercial. She was like, holding the baby, cooking and working a job at the same time. And I'm like, is that really how we're supposed to be? I just remember that was kind of like, commercials were like trying to tell us, even as kids back then, as young women, we can do everything.
right, all at the same
all,
time.
all at the same time. Yeah, multitask. Yeah, like,
I can't. Yeah, no, I can't anymore. I mean, I can rev up to that extent, and it's a bit of a high, or it's exciting to get really revved up. And I'm probably more comfortable there than I am in a sluggish place personally. So that's a good fit, right? I'm happy to be activated. but yeah, I mean, I because I'm madly in love with medicine and it was my first love, it's like I'm very loyal to my medicine and to the advocacy work and to making sure that thousands of people who don't know it are being affected by the positive change that I'm able to impact. That to me is like the biggest thrill ever, is the thought that a generation down the line, kids are going to have naturopathic doctors as their primary care providers in New Mexico, and they're never going to know how that came to be, and that's great. Right?
Awesome. Yeah, I like that.
Yeah.
Yeah.
It's like the man behind the curtain or something, feeling just like, oh, I can help people I'll never know. I'll be dead when they are having their needs met. So that's passion. Oh God, overwhelming passion for the medicine. And then you have your kid, or I did, and now I'm head over heels passionately in love with my family too.
Yeah.
So it's like every minute I'm doing something that I love and missing something that I love.
Oh, that's beautiful. That's comes from such a heart space.
Yeah.
Yeah.
True, and it hurts. It
Yeah.
hurts and it's wonderful at the same time. I mean, of course, I'm overwhelmingly grateful that my time is spent doing something that feels impactful and important and fulfilling. And at the same time, I would like to just play puppy trek with my kid or something.
Yeah. Yeah. No, I think that's one of the things with people who have families and work, and I think men and women. I mean, we in our work we're actually stepping away from something for a while to serve others, but people don't always remember that we're human beings too, and we have a family and we have other obligations, and that gets kind of, I don't know, lost in the picture sometimes.
Yeah, I mean, it's all about the long process of learning boundaries and communication, and being able to express your limitations and accept them, and still also show up in all the different ways. And then, of course, taking a few days here or there completely alone for me has been profoundly essential. I mean, that's something that I've built into my life now, where I get a couple of days completely to myself a couple of times a year. And if I do that, then I'm pretty okay in terms of being able to show up.
Yeah, because that's a big part of the work, is that we have to show up for others, but we have to take care of ourselves first. It's our own self-care, and I have a pretty disciplined self-care practice too, just to be able to show up for others. And
that's evident. I can see it from here, your self-care practices. And I will aspire to be more like you in that way. I do aspire.
All right, I think this is a good place to stop, Lily. I'm gonna pause the video. This is so great to talk to you today. I feel like I learned something new too. This is awesome.
You did?
Yeah.
Oh, good.
Yeah, it's great. It's awesome.